Hello, Dr. Pergande here with Thrive Chiropractic and Wellness Center. Welcome to our first video in our Discover Wellness series. I am super excited about this series. The information we're going to cover in these videos is for you to help you get better faster and discover what it's like to truly be well. So we all want a body that's healthy, vibrant, and full of energy, but that doesn't happen by accident. In order to know how to best take care of our bodies, we have to have some understanding about how the body works. Now, don't worry, I'm not going to go full science nerd on you here. I'm going to keep it very simple. Sound fair? All right, let's dive in. I'm going to share my screen with you. So I have a diagram here. Here at the top, we have your brain. And your brain, of course, is connected to your body. And it's connected to your body by your nervous system. Your brain sends signals down through your brainstem, spinal cord, out over your spinal nerves to every organ, tissue, and cell in your body. Now, you may have never thought of it this way, but you literally live your life through your nervous system. Every sound, taste, touch, smell, sight, all that energy and information gets transmitted to your brain so you can make sense of the world and respond appropriately. And of course, your brain and nervous system controls all the other things that you're less aware of. Your heart beating, your lungs breathing, your stomach digesting. And when your brain is communicating with your body without any interference, we have function. Your heart, your lungs, your immune system, your muscles, functioning exactly how they're supposed to. And when the brain is communicating with your body and it's functioning properly, we have a state of ease. All the gears are meshing like a well-oiled machine. Your body has the energy to do all that it needs to do and has energy left over to do more. Now, when you have this state of ease, you have that optimal potential, and we refer to that as a state of health. So your brain is communicating fully 100% with your body, allowing your body to function right on every level. You don't feel function, by the way. You don't feel your brain communicating with your body. You don't feel a state of ease. You don't even feel health. You feel a lack of symptoms. You can say you feel healthy, you feel vibrant, you feel great, but you don't actually feel health. But when your brain is communicating with your body and you have function, ease, and health, then at the end of the day, you can say, you know what? I feel good. Now, how many people do you know who has a body that's working just like that? Why isn't this the reality, even though this is how it's supposed to work? Well, here's the challenge. We can have nerve disturbance or interference between your brain and your body. Chiropractors call this a subluxation. Don't get too caught up on that word. That's just the clinical term. Now, if you have interference between your brain and your body, it's kind of like having only 1 or 2 bars out of 5 on your cell phone and trying to communicate with your friend or spouse. There is going to be a lack of communication. And that interference doesn't allow your body to function the way that it's supposed to. So your body begins to malfunction. When your body malfunctions long enough because your brain can't communicate with your body because it's interfered with, we have dis-ease. That word looks pretty familiar, doesn't it? Yeah, left alone, dis-ease leads to what? Disease. So, when your brain is not able to communicate with your body because you have disturbances in your nervous system and then it malfunctions, which you can't feel, and it's in a state of dis-ease, which again, you can't feel, you don't have health anymore. You have ill health, which again, you can't feel yet. But as it builds, eventually, instead of feeling good, how do you think you feel? Yeah, bad, not great. So are your symptoms your headaches, your husband's low back pain, your daughter's ear infections? are they a cause or an effect? An effect. That's right. The thing we feel is the effect. The nerve disturbance that isn't allowing your brain to communicate with your body, so your body can't heal the way that it wants to, the way that it's supposed to, that is the cause. And your body is designed to heal. That's what it's meant to do. If you cut yourself, it heals. If you break something, you might need a cast, but the cast doesn't heal you. Your body literally knits itself back together. And it doesn't matter what it is. Your body is designed to heal. Now, if I just cover up your symptoms so you feel fine, are you necessarily healthy? No. Feeling good, aka having no symptoms, does not mean that you are healthy. But what are symptoms? They're an alarm. They're an effect saying, hey, something's wrong. Something's not right. Now, if you woke up to this going off in the middle of the night, how many of you would just take a broom, knock it off the wall, beat it to death, and go back to bed? Now, as silly as that sounds, that's how most of us have been trained to deal with our symptoms. It's what our entire quote-unquote healthcare system is built on. Don't worry about what's causing the symptoms. Just take this to cover it up, to mask it. Maybe we'll take something to speed something up or to slow something down. Or hey, maybe an organ is causing a symptom, so let's just cut it out. But if you take Excedrin migraine for your headache, are you treating the effect or the cause? Is your migraine due to an Excedrin deficiency? Of course not. We need to address the cause, not just the symptoms. Now, in the next video, we're going to talk about what causes nerve disturbance. In the meantime, knowing what you know now, I want you to ask yourself, how important is it for me to have my nervous system functioning optimally as often as possible from this day forward for the rest of my life? In other words, how important is it for me to keep my nervous system free and clear of interference? All right, you guys, until next time.